Hello, I am Simon Morrow, a specialist occupational disease lawyer and lead of the COVID subject matter group within the disease team. The nature of the coronavirus and the extraordinary passage of events since March 2020 has made it especially important for a multidisciplinary team to consider and deal with the wide variety of legal issues arising. Although we've received instructions on only a small number of claims so far, the UK has up to now had some 5 million recorded cases of COVID-19, with over 128,000 deaths attributed to the disease. The Office of National Statistics states over 1 million people in the UK are reporting symptoms associated with long COVID. These so-called long haulers are often still suffering a range of symptoms, particularly general fatigue and brain fog, more than 12 months after infection. Some of those suffering from long COVID have not recovered despite initially only having a mild infection. It's simply not known at this stage who will go on to develop long COVID or why this is. An obvious concern with regards to lifting restrictions is that younger people and even children who've not yet been vaccinated are at risk of infection and developing long COVID. It's also important to note the ongoing uncertainty as to whether even being double jabbed reduces the risk of long COVID. Despite the success of the vaccination programme, the circulation of the Delta variant means that case numbers are continuing to rise. The reopening in England on 19th July, along with the recently announced removal of quarantine for those vaccinated on their return from amber-list countries, will almost certainly mean that infections will continue to increase. The new Health Secretary has himself admitted that going forward, there's a likelihood of 100,000 or more infections per day. This results in an unprecedented potential for injury claims, and there's undoubtedly an appetite on the part of claimant lawyers to pursue these. Another issue arising from the reopening of the economy is the prospect of a conflict between, on the one hand, government policy on the removal of restrictions, such as the requirements for working from home where possible, social distancing and mask wearing, and on the other hand, an employer's duty of care owed to its employees and members of the general public. The challenge faced is even greater for businesses that might employ workers who live on one side of the border, say in England, but who work across the other side of the border in either Scotland or Wales, or vice versa. There are likely to be different rules applicable for the different jurisdictions for the foreseeable future. Breach of duty is unlikely to be straightforward in infection cases because of the number of changes in national guidance since March last year. To address this, we've developed a timeline to track these changes, not only by dates, but also by reference to industry or sector and the jurisdiction in question. This is already proving to be an invaluable tool in terms of the handling of these claims. In addition, given the prevalence of the virus and the prospects of infection from a variety of possible sources, establishing causation is likely to be difficult for claimants. Of course, COVID-19 itself is only part of the problem for businesses and their insurers. The measures brought in to control the spread of the virus have themselves created challenges, for instance, mental health issues, upper limb or cumulative back disorders arising from home working, increased dangers in the workplace arising from reduced staff numbers or revised working practices, discrimination claims relating to mask wearing and the like, and potential new opportunities for fraudsters. There are numerous legal issues thrown up by this unprecedented situation. The COVID SMG has been set up to specifically prepare for and address these issues and the claims potential. The group can call upon a mix of experienced short-tail disease lawyers familiar with handling respiratory diseases of this nature, but also specialist long-tail disease lawyers such as myself, who are best equipped to give an insight as regards the challenging causation issues that will inevitably arise going forward. Aside from specialist claims handling expertise, BLM also has employment experts to advise on the challenges arising both in and out of the workplace, health and safety specialists to address regulatory matters, and a health and social care team able to deal with the relevant issues arising within hospitals and other medical institutions, as well as care homes. Please get in touch with me should you wish to discuss any of the issues arising in this area, and thank you for watching.